Bismillah ar-Rahman ar-Rahim. This video is uploaded for the Qahra University College of Dentistry. Our lecture is the facial muscle. You know that all facial muscle is responsible for the facial expression. All the facial muscle is innerved by the facial nerve, the seventh cranial nerve, except the muscle of mastication. The muscle of mastication is innerved by what? By the mandibular branch of the trigeminal nerve. You know that trigeminal nerve is divided into three branches. The first one is the ophthalmic branch, which is sensory. The second one is the maxillary branch, which is also sensory, and the third one is the mandibular branch, and it is motor. Motor mean movement, mean voluntary muscle. Okay. So we're gonna talk about the this muscle, just the names, not the origin, not the insertion. The first muscle consists of two parts, which is called the occipitofrontalis muscle. The occipitofrontalis muscle. This is the first part, which is called the frontal belly of which muscle? The occipitofrontalis muscle. And this part called the occipital belly. So this is the frontal belly of occipitofrontalis muscle, and this is the occipital belly of the occipitofrontalis muscle. Between muscle and muscle there is a tendon, and in the end of the tendon there is aponeurosis. So this aponeurosis that connect the frontal belly and the occipital belly called galea aponeurotica. Galea aponeurotica. What is the innervation of this muscle? It is the facial nerve. This muscle called procerus. Don't focus on it. And this is the depressor supercilii. So this muscle is the frontal belly, and behind it there is the occipital belly. Of which muscle? Occipitofrontalis muscle. This muscle around the eye is called orbicularis oculi. This is orbicularis oculi. The orbicularis oculi is consists of three parts. This is the orbital part, and this is the palpebral part, and there is a part here called the lacrimal part. Okay, it is responsible for the closure of the eye. So the lacrimal part is squeeze the nasolacrimal gland, and the palpebral part is responsible for light closure of the eye, when the orbital part is responsible for the tight closure of the eye. This is the procerus, and this is the depressor supercilii. What about this muscle? You know the muscle, we name the muscle by its position. So these muscles are connected to or attached to the zygomatic bone. So this is the zygomaticus minor, which is small, and this is the zygomaticus major. If you see here, this is the zygomaticus minor, which is a small one, and this is the zygomaticus major. Okay, what is responsible for? Widening of the angle of the mouth. Widening of the angle of the mouth. What about the muscle of mastication? The muscle of mastication are four muscles. The first one is the temporalis muscle. The second one is the masseter muscle. The third one is the lateral pterygoid, and the fourth one is the medial pterygoid. So this is responsible for what? Responsible for mastication. Okay, which nerve supplies these muscles? Is the mandibular branch of trigeminal nerve. The first one of this muscle is the temporalis muscle. So this is the temporalis muscle. This muscle is temporalis muscle. The second one is the masseter muscle. This is the masseter muscle. What about the medial and lateral pterygoid? The medial and lateral pterygoid are deep muscle, which not shown here. Okay, so this is the temporalis, this is the masseter, this is the frontal belly, and this is the occipital belly. These muscles called occipitofrontalis muscle. This aponeurosis called galea aponeurotica. This muscle is the temporalis muscle, and this muscle is the masseter muscle. These which attach to the zygomatic bone called zygomaticus muscle. This is the small one, which is zygomaticus minor, and this is the larger one, which is called zygomaticus major. You can see it here. This is the zygomaticus minor, and this is the zygomaticus major. This is the frontal belly, and this is the masseter muscle, and this is the temporalis muscle. We say that temporalis muscle, masseter muscle, medial pterygoid, and lateral pterygoid are the muscle of mastication. This is the anatomy. What about the function? This muscle, which is deep here, called the buccinator muscle. This muscle is the buccinator muscle. The buccinator muscle is anatomically not a muscle of mastication, but functionally it has a function, a little function of mastication. Even in a newborn, it is responsible for suckling. Okay, so this muscle is a buccinator. Anatomically, it is not a muscle of mastication. This deep here is a buccinator. What about this muscle? This muscle called rosaris muscle. This muscle called rosaris muscle. This is the zygomaticus major. This is the zygomaticus minor. This is the orbicularis oculi. This is the orbital part, and this is the palpebral part. This is what we call it procerus, and this is the depressor supercilli. What about this muscle? This is on the nose, so we call it nasalis muscle. On the nose, so we call it nasalis muscle. It is responsible for the flaring of the nasal fold. And this is on the mental foramen, so we call it the mentalis muscle. This is the nasalis, we called it transverse nasalis muscle. Transverse nasalis muscle. When this is mentalis muscle, this is the masseter, and this is the rosaris muscle. We have four muscles. You're gonna know it by their position and their attachment. Their position and their attachment. The first one is this. This is above. So we above means elevation. So this is what? This is the levator, and it is attached to what? Attached to the lips. So this is the levator labii superioris. Levator labii superioris. You can see it. Levator labii superioris. Levator means elevation. Labii attached to the lips, and it is above, so it is superioris. Levator labii superioris. This one is also levator labii superioris because it is attached to the lip. But what the difference? This is attached to the nasal bones, so it is called levator labii superioris alacnasi. You can say it both levator labii superioris. These muscles are the levator labii superioris. What about this muscle? This muscle is not just here, it is around the mouth. Okay, this is called the orbicularis oris. Orbicularis oris. It is like the orbicularis oculi. Oris mean the oral cavity, and the orbicularis oris, it is an orifice, so it is responsible for what? For closer the eye. Return to this muscle. This muscle is the levator labii superioris, and this is the levator labii superioris alacnasi. Because it's what? It is above. So above, it's mean retract, pull up. It's mean elevation. So it is levator. What about this muscle? What about this muscle? This muscle. This muscle is attached to what? To the lip, so it is labii. But it is below, so it is inferioris. And what do? Pull down the lip, so it is depressor labii inferioris. Depressor labii inferioris. This is levator labii superioris. Levator labii superioris, depressor labii inferioris. We have two muscles left. This is the angle of the mouth. This is the angle of the mouth. So if the muscle attached to the angle of the mouth, we will call it anguli. Anguli. And it is above what the function? It is elevation. So levator anguli oris. This is levator anguli oris. Levator anguli oris, because it is attached to the angle of the mouth. This muscle, which is triangular in shape, and you can know it by its shape, and it is attached to what? To the angle of the mouth. So and it is below, so we'll pull down the angle of the mouth. So it is what? Depressor anguli oris. Depressor anguli oris. Okay. What about here? These muscles are what? These muscles. This is the levator labii superioris. This muscle is the levator labii superioris, and this muscle is levator labii superioris alachnesi. This is the orbicularis oculi. This is what? Attached to the angle of the mouth. This in green color, attached to the angle of the mouth. So it is levator anguli oris. What about this muscle? Triangular in shape. This is attached to the angle of the mouth, and it is below, so it's pulled down the angle of the mouth. So it's called depressor anguli oris. And this muscle attached to the lips, so it is, and it is below, so it is the depressor labii inferioris. Depressor labii inferioris. A review about the muscle. This is what this is. This is the frontal belly. What about this? This is the temporalis. Yes, this is the temporalis muscle. This is the masseter muscle. This is the rosaris muscle. What about this in purple color? This is the buccinator muscle. What about these muscles which attach to the zygomatic bone? This is the zygomaticus minor, and this is the zygomaticus major. What about this? This is the orbicularis oculi. What about this? This is the orbicularis oris. In the nose, nasalis muscle. In the mental foramen, mentalis muscle. This muscle is temporalis muscle. This is the procerus, and this is the depressor supercilli. Okay, the zygomaticus muscle, the function of it is widening of the mouth. So in smiling we use it. Also the rosaris muscle. The buccinator, functionally it is used for mastication.